Good afternoon, everyone. Thank you for being here. Let's go over some numbers, take some questions. Unfortunately, we lost a 70-year-old woman, Caucasian woman, to COVID-19 in the last 24 hours in a hospital. And New York State has reported that we have lost one neighbor in a nursing home over the last 24 hours as well. So we now have lost 141 individuals to COVID-19 since March. So certainly continue to grieve with these folks, their families, and remember them, and please keep them in the prayers as everybody we've lost in our community over this period of time. Very difficult to mourn and be together with the limitations that COVID-19 puts on us. Related to testing, we have now tested 38,773 individuals. 37,389 tests have been returned, 252 returned since yesterday. There are 2,152 positive cases in Onondaga County since March 16th, 23 new cases since yesterday, and 35,237 negative results since we started this process. We sent 1,366 tests yesterday. We have 1,384 pending tests. Our infection rate right now is at 5.8%, down drastically since we've opened up testing to the community at large. Over the last 3 days, in the New York State Department of Health eClares system, this is when they receive test results back. We have averaged 1,383 results per day, and our infection rate on our 3-day average is 2%. So again, the infection rate, the lowest we've had since we've been tracking this. So good news for the community related to that. We will continue to do universal testing at the Syracuse Community Health Center for everyone. Certainly, we encourage everybody, especially if you have not been physical distancing, to take advantage of this. Mobile testing, there are mobile testing opportunities. Today we are at West Genesee High School. Thursday we will be at the Immaculate Conception Church parking lot in Fayetteville. Friday, we will be at PSLA at Fowler High School. And then next week, we'll be doing our mobile testing in other parts of the community that we've yet to be in as well. So when you look at the testing strategy, we have obviously our hospitals doing testing, Syracuse Community Health Center is doing testing. We have a mobile lab that's going out to different corners of the county, hunting down asymptomatic individuals with this virus and giving people the opportunity to ease their mind, to get a test. So certainly please take advantage of that. If you're in the eastern suburbs, we'll be at the Immaculate Conception. Those in the western suburbs still have a little bit of time to get to West Genesee High School. But we'll make our way around. We'll get back into these communities again. Looking at our mandate, 775 tests a day for the Central New York region on average. Yesterday, we had 1,651 tests. Our daily average from May 26th through June 1st now for the region, 1,594 tests. I'm okay at math. That means we've doubled our mandate. That's good. I want to thank Chairman Hyder in Cortland County, Chairman Becker in Madison County, Chairman Weatherup, as well as Chairwoman McNabb-Coleman in Cayuga County for their efforts in helping us get to these numbers in a sustained way. They're fantastic partners. Hospitalizations, 71 individuals in the hospital, down 4. Good number, over 40 people still in the hospital related to nursing home policy set forward by the state. If you're in a nursing home, that's where you live, that's your home, you get COVID, you end up making it in the hospital. Once you recover to go back to your home, you have to test negative. Testing negative is not as simple that you're recovered based off of CDC guidelines or no longer need to be in a hospital. So we don't know how long it takes people to test negative after they've had COVID. So that's a challenge. We've put forward 2 solutions to the state. Hopefully we'll have approval on those. Then we'll see our hospital numbers drop off drastically. And so we really know where it is today. We know our numbers have dropped off drastically. We know our infrastructure is in fantastic condition. Our community should celebrate the fact that we've flattened the curve. And so far through Restart, we are in a position where we are not going backwards. We're just going forwards with our data. 13 in critical condition. This is down from yesterday. Out of the folks who are still in the hospital, 43 Caucasian, 14 African American, 5 of another race, 9 have declined to share their demographic information with us. We've had 256 people who have gone into the hospital sick, have been released healthy. Very good news. So overall, related to cases, 2,152 positive cases, up 23. Again, 23 is a nice number. 4 of them household contacts, 7 related to senior living facilities. So that number continues to come down. That's important. Those are the cases where they have a high likelihood of becoming hospitalizations, ICU rooms, and then we've seen that we don't always get our neighbors back once they go into the ICU. So having that number go down is very important. So that's very good news. That leaves 12 community spread. Again, really solid number related to community spread. So certainly happy with our cases as we're in phase 2 of Restart to date. Presently monitoring 906 active cases. That's down 3 from yesterday. 1,110 people have recovered. That's up 24 from yesterday. Asymptomatic percentage, now 30% of our new cases. So that percentage has come down a little bit, and that's probably attributed to the senior facility numbers coming down because so many of those cases were related to employees who are asymptomatic. Looking at our cases overall, 1,282 females, 870 males, 103 under the age of 19, 355 in their 20s, 279 in their 30s, 266 in their 40s, 343 in their 50s, 274 in their 60s, 210 in their 70s, 197 in their 80s, 124 in their 90s, and we have 1 individual where we have not identified their age yet. We will identify that age, I promise you. The city of Syracuse, 1,208 cases to date, 578 recoveries. Clay, 169 cases, 111 recoveries. Onondaga, 135 cases, 38 recoveries. Geddes, 111 cases, 31 recoveries. Salina, 94 cases, 58 recoveries. DeWitt, 80 cases, 57 recoveries. Manlius, 77 cases, 56 recoveries. Cicero, 70 cases, 41 recoveries. Camilla, 66 cases, 40 recoveries. Lysander, 37 cases, 29 recoveries. Pompey, 26 cases with 23 recoveries. Van Buren, 30 cases with 10 recoveries. Skinny Atlas, 15 cases and 15 recoveries. Lafayette, 8 cases, 4 recoveries. Marcellus, 7 cases and 6 recoveries. Elbridge, 5 cases and 2 recoveries. Atisco, 5 cases and 5 recoveries. Tully, 4 cases, 2 recoveries. Spafford, 3 cases, 2 recoveries. And Fabius, 2 cases and 2 recoveries. We can take questions related to Restart. Certainly, it's a big month fiscally for the county of Onondaga. We have sales tax payments coming in, I believe 4 of them in the month of June, that will help really drive a lot of our decisions. We don't have good decisions in front of us. Related to that, the state of New York has been threatening 20% cuts to us. Certainly that's a body blow that we cannot absorb, and we're waiting on our partners in the federal government to come up with a COVID 4.0 stimulus package to address the fact that we were asked and we listened and shut down our economies to flatten the curve. So certainly there needs to be an acceptance from this government that they need to help. They have the ability to sell treasury notes. We don't. And we certainly need their help. But we're going to have tough decisions to make. Our partners at the county legislature are going to have to step up. We get elected. We got tough decisions to make. We can't have an unbalanced budget. And so if we get help, the decisions get a little bit better. But just because you don't like the decisions doesn't mean you can derelict your responsibility to govern. So it's going to be a telling month in June. And unfortunately, if we don't see some help and we see additional cuts, the decisions we have really been made for us by other entities. So we can talk more about that. Child Care Solutions, again, our daycare program for our frontline workers, our essential business employees, 315-446-1220. If you have a daycare challenge, please call. We have slots. We did this for you. Make sure you can go to work, recognizing that your children are supposed to be in school right now, but because of this pandemic, they're not. So please take advantage of this. And again, 211 for social and emotional support. A lot going on. It's been a tough 90 days through this pandemic, and it's been a tough last 2 weeks. So people need to, recognize if you need some help, nothing wrong with that. 211 is a resource that we have to help give guidance and to help with social and emotional support. Questions?
Do you have exact numbers from these mobile testing units yet or not?
I think yesterday we did over 350 tests. I don't have the exact numbers. What happens is we do these tests, these numbers fall, we then have them processed at the Syracuse Community Health Center. So each day I'll get a Syracuse Community Health Center number, and that will be everybody from our mobile testing, everybody who went to that facility, and then say we're doing testing at an independent living facility that day, all of that. So it's tough for us to break that out, but yesterday was a big day from the mobile testing. I think probably our largest day we've had.
What stories are your teams hearing on the ground at these mobile testing sites? The people that are showing up, did they just not want to come into the city to get tested earlier, waiting for it to come to them? Is it a new contact and it happened to be close by? What kind of stories are you hearing?
Yeah, I think having it in people's backyards makes it easier. People are busy. A lot of people are still nervous. If you've all been to the triage testing site, you see how it works. Nothing really to be too scared about. Somebody comes up, gives you a test in your car, but there's still confusion out there. So, and again, for some people that aren't used to coming downtown, that's that's not something that they like to do. So, by getting out into these other communities, we found. We went to the southern towns. We found a couple cases. I think there's 4 cases that popped up in the southern towns. So that's good. That's infection that we found. Now we're going to quarantine. We're going to get these people better, and we stop the spread. So this is effective because these might be people otherwise that maybe want to go and get tested, maybe try to tough it out if they have light symptoms, and some of those symptoms could be COVID.
And to go a step further, what is the general cause of infection in these latest cases? Is it where they work? Is it lack of social distancing? Is there a theme? Yeah,
it's tough to tell where it came from, unless there's a couple different cases that point at the same incident. Certainly we'll be following what's happening if all of a sudden we have 15, 20 people that were engaging in the protests and all of a sudden they all have COVID. We'll be able to put those pieces together most likely. And again, we encourage our protesters to go get tested. You can get tested. Not everybody was as smart as some of the protesters who were wearing masks and doing what they needed to do, but we're distancing. So go get a test. It's not going to hurt you.
What do you want the legislature to do?
Look, the legislature, we're going to have decisions to make in June. And it's easy when you can take votes to say no. And when you don't like your choices, it's real easy to say no. But that's not the responsible thing to do. So when you're in the middle of a pandemic and a crisis, you got to get to yes. And so if we're getting cuts and our revenue falls in, the decisions are really made. We just have to formalize the decisions. And so that means you can produce more revenue or you have to get rid of costs. So we've found balance every step of the way, and we've gotten this community internally within my administration to make cuts into our budget so we can get to June and we could have information to be able to make moves intelligently, but we don't have any more time in June. So we're going to have more data for the legislature. They're going to have to act. There's two ways you act. You either cut or you raise revenue. And the revenue raise is very temporary, but there's nothing else to do. Those are the two choices. So no and no doesn't work. That means you're not doing your job.
What's the latest you'd be comfortable getting that 20% additional that the state may take away? What's the timeline on knowing I need to know we're going to have this money in order to decide what we do locally?
Yeah, I mean, look at our gap. Even if we get federal help, we can maybe get to it with everything we've been doing. But if the state cuts us 20% on that, we'll have dollar for dollar cuts. There's no absorbing it. So we've messaged that. It's just the reality. You cut us 25, 30 million bucks, it's going to people. There's nowhere else to cut. So that's just the reality.
With the timeline on that?
I don't know. The legislature gave the governor the ability to make this decision at certain points, and they have the ability to respond once he makes the decisions. But you can't cut a government our size 20% on the mandated service they ask us to do. They don't just ask; they tell us you have to do these services. And now they're telling we're going to tell you have to do them, and now we're not going to give you any money. We're going to cut it. So if you do that, there's no decision for us to make. That we get cut by the state 20%. That's coming out of people. We don't even have a choice. So that's just the reality.
When would layoffs happen if you don't get the service?
At the end of June, we have no more time to be able to meet a budget hole. June is everything for us fiscally. If we do not have federal help, we do not have commitments from the state that they're not going to hit us. We do not have the ability from our own legislature to make some decisions. Then bad things are going to happen. That's just the reality. We've gone as long as we can, where you run out of time. You have a budget, you projected revenue, the revenue goes away. You have to make up that revenue over the last 6 months of the year, and so we have some tools at our disposal, and we've been using those tools, and we'll continue to look at other tools, not to impact our workforce, but you can't be giving a massive deficit and then get cuts on top of it for services you're telling us to do, right? We have no choice in some of these services. You tell us to do it, but then you're going to go cut the funding. That means the services are going to get cut. And what's behind the services? People. So June, we will know at the end of June where we are fiscally, and the decisions that need to be made will need to be made.
Why is June the tipping point? Just because we're halfway through the year and you...
We have no more time, Trish, to make up the deficit with the savings. With cuts, we have to remember, you have a $100 million hole. To get that $100 million hole in half a year, you have to cut $200 million. So you're running out of time. Every day you spend money and you don't cut it, you run out of time. So that's it. We'll know how bad the revenue shortfall is from the shutdown in June, because we'll have all of our sales tax payments through the month of May and the beginning part of June, when we still won't be in phase 4. And that's why when we push for looking and being mobile with Restart, ways that you can try to do some of these things, it's for these businesses to start making a living, and when they start making a living and there's more economic activity, eventually that gets down to us too in the state with revenue. So it's the reality fiscally that we're in June, a lot's going to happen, and then the leaders in this community are going to have to step up and make tough decisions.
The governor's latest executive order an hour ago allows for the reopening of outdoor low-risk recreational activities and businesses providing such activities. Are you aware of kind of how that affects Onondaga County based on your regional call?
Haven't seen the executive order. outdoor low-risk recreational activities sound good to me. Don't know what that means, but certainly that's anything you can do in a safe way to open up more opportunities for people to do things safely. That helps with the mental health of the community. Also, there's an economic component to that as well. So pleased to see the order, even though I'm not sure exactly what it applies to.
That doesn't possibly mean the restaurant service outside? That would be
No,
more
that would be
explicit?
specific. They'll be specific on that.
Starting tomorrow, Syracuse University will start allowing faculty and staff back on campus in a limited capacity. Can you talk about what your discussions with them have been and what guidance you may have given them?
Yeah, the university and the chancellor and Vice President Chancellor Michael Haney have done a fantastic job, and they have really put a lot of effort and thought into how you bring people back safely, let alone our employees, but the students. And there is a tremendous amount of planning that goes into this in collaboration with our health department, with my Deputy County Executive Ann Rooney, and others. And so we're very comfortable with what the university's plan is, and we're very excited for them. And there's going to be, with any of our universities that are welcoming in students from who live in other parts of the country or the world, there's going to be testing. Testing is going to be a huge piece of this. And it will be testing when you come into the community. It will be testing randomly. It will be testing throughout the year. Some of the research that we're working on, I know Trish gets really excited talking about our sewage tracking of COVID becomes really relevant on campuses, that you can potentially track that via dorm. So there's a lot of things that can be done and that have been thought out. So we're excited about that. Syracuse University and other local colleges here will be leaders in this space on how to safely get things going again.
What more can you say about how exactly that testing will work for students, or guidance that you've given them? Is it going to be when students come to campus before they can even enter on campus at all? What does that look like?
Yeah, I think I think it's a little too early to go into specifics because the state's going to come out with some guidance on this in the near future on what they want to see happen. We may want to add on to that depending on what we see the guidance. So we may say to SU, we like what New York did here, but we want you to do these other things as well. And SU may see, look, thank you for the guidance here, but we feel more comfortable if we do this in addition to that as well. So that's going to be a conversation, but certainly for residents that are nervous, and a lot of residents in the university neighborhoods are nervous, there will be a lot of testing, and we will work through this to make sure the community is safe and we can get the university back educating our future leaders.
Speaking of planned testing, appeal to the state about the mall closure order, what can you say about that development, and also what plans and procedures Destiny has in place to share?
Yeah, so they should share that plan with you, Doug. I haven't reviewed it. Our health department reviewed it. But certainly to go into that building, you need to wear a mask. And so that I know is part of it, and they have the ability to, and I think they would implement people who are not wearing a mask to ask them to leave. That is a large building. It's one of the largest buildings that you can think of. Therefore, the easiest building, I believe, in our community to physically distance in, unless you're in the dome on one end to the other and there's only a few people in it. So we need to get that building open. And that's what we talk about at our regional call. I know they sent a letter. I know they're communicating with the second floor. I understand the state's concerns related to downstate malls and all the different back and opportunities to travel due to the mass transit infrastructure there. But this is different. That building needs to be open. I have dozens of small businesses on the sidelines that cannot afford to be on the sidelines. And they can open it, and they can do it safer than any other retail establishment in our county. So we need it open. It's got to get open. Great Northern Mall is another one where I have business owners in that mall that are hurting. And these are folks that haven't qualified for the same help that unemployment, that your employees qualify for. They can't get these PPP loans that other small business people get. They can't get an unemployment check. They're running out of money. We need to use common sense here. So that's I think we're making progress on that front, but it can't happen fast enough.
Are the state leaders on the call hearing this?
Yeah, they are. They are. They've been very good. They've been very good. And again, these are things where I feel good about. If I feel like I wasn't being listened to, I would tell you right now that that's what I feel like.
Restrictions in it, just thinking, the governor talked about, you can't go to Palisades downstate, you might show up at Destiny.
Yeah. I mean, there's a lot of look at. It's all about risk mitigation, and there's a public health cost staying shut down longer than you need to be too, and that's I think we're seeing that play out in our community. So the concept that you have one building open, that it's going to draw everybody. That's like me. Look at Destiny's a little different because it does draw people from Canada traditionally in good times, and maybe from other parts of the downstate community, maybe. But it's kind of like an argument. Like if you have a mall open, just because you have one open anywhere, that means everybody's going to come from New York City, and they may have a higher infection rate, yada yada. We haven't seen that at Oneida Shores. I haven't seen that at the zoo. So I just think that that argument doesn't really carry a lot of weight with me with this right now in the middle of a pandemic. If people are still trying to get their own houses in order in their own communities, I don't think you see a lot of people traveling from community to community. Because if you did, you would see, as your outfit has reported on, what's our air traffic down month over month, Doug? Like 96%. So if people were traveling from community to community, I think we'd see more of it with hotel room rates being higher than they are. They're all off 94, 95%. So at some point, we're going to want these things to happen. But right now, this is about getting that building open for those small businesses so they get a little bit of money to pay their bills.
About 20 minutes after you walked away from the podium yesterday, the Syracuse Nationals announced its cancellation for this year. Your response to that?
Yeah, it's disappointing. I've been talking to the Nationals. We've been trying to figure out with these things. You figure out a way. Is there a way we can get to yes? As complex as this is, how can we get there somehow, and then put that plan out? And we ran out of time. So it's disappointing. They'll be back in 2021. It will be better than ever, but it's disappointing.
I remember when the governor was here, we talked with him about it, and he wanted a drop-dead date. Was that date given to the governor's office?
I don't know. I think this was more driven by the fact that it's like these concerts. We didn't tell people they can't be at the amphitheater, right? A concert schedules 20, 25 events. For them to do 1 or 20 or 25, it costs the same amount of money. They don't make money till the back end of their season. So if you can't do all 20 or 25, they can't afford to do it. That's how that works. And this is similar. There's a certain date where you need to get these contracts done, and you need to have your sponsors lined up. If your sponsors aren't going to write you a check if they don't know if it's going to happen, so then by a certain date, it just can't come together. And so, it's unfortunate. I mean, look at it. There's so many things about this pandemic that are just painful. And from the entertainment infrastructure side of things, I mean, we're going to have our best season ever at the amphitheater. The Nationals, the fair, bigger, better than every year. So from the entertainment infrastructure, it's brutal on the opportunities that the community is missing out on. But in addition to that, the economic impact of that for these businesses. And then you look at the loss of life has just been brutal as well. So it's just, you see how bad this pandemic is when you look at all of the victims as a whole. It's hitting all of us one way or the other.
Summer camps, based on the guidance you've seen, do you recommend that parents start making plans for that? What have you heard about different camps reopening?
Yeah, look, at practical decision. We're happy the governor made it. There's ways you can do these things safely. And if you're one way of learning, and that's what we're doing, everything restarts an experiment, right? And you're testing the virus. you gotta get kids together again, or else how are you gonna have school in the fall, right? So summer camps, it addresses the daycare issue. It gets kids together. We're gonna figure out the safest way to do it with our partners. The state's giving out some guidance now that's very helpful, but it's an important step forward. This is gonna help parents and families. It's gonna help the kids. The kids need to be together too. And we'll learn from it. We'll take those lessons. We'll track our data out of those camps very closely, and then we'll take that information and help us prepare us for when school gets started in the fall, because we got to get there.
Going back to the budget issue, you're really asking both larger governments for help. You want the state to come through with what you planned on coming through, and you want the federal government to not only help the state do that, but directly help the county. Is that a correct interpretation?
No unfunded mandates. That's what we're asking for. Federal government gave the state of New York and Onondaga County an unfunded mandate when they said you need to shut down till May 1st. We may have agreed with that, but that's essentially what it was. So the state of New York needs help because of that, and so do we. We do many, many services that we're told we need to do that. We may agree with that. We may agree with those services, but needless to say, we're told to do it. So if you cut us, you're creating unfunded mandates, and if there's no money, there's no way around it, then we need to cut into the bone. We've cut everything off. We've already cut parts of the bone with what we've done mid-year. We're digging and diving into the bone if we don't get federal help, and if we don't get the state of New York to hold us harmless from further cuts. Remember, the state legislature already took $2.2 million from us this year into a fund for hospitals, and the year before they took $2.5 million from us of our sales tax money. So it's our sales tax money to go to pay for villages and towns funding, because they cut their funding and then they took that. So we already took a hit in the budget process, and now they're talking about larger hits.
How's the testing at the jails and of the corrections officers?
Yeah, I'd check on that. I'm not sure if we've gone through the whole thing. Certainly, the activities of the last 72 to 100 hours have slowed that down. So we can't, with the protesting going on outside the Justice Center, that creates an environment inside where it's harder to interact with the residents of the Justice Center. So that the actions lately have slowed down that process. I'd have to check in to see how things are out at Jamesville.
What else did you guys talk about on your call today?
Higher ed was on there, so there's a higher ed briefing. So I think the state's going to have some guidance related to higher ed, which is needed. So that was good. We went through our numbers. Our numbers were pretty solid. Everything kind of trending out nicely related to positive cases, and hospitalization is even outside of the folks that are still in the hospitals that don't need to be. The numbers have gone down over the last week as well. So those are all good signs. We talked about everything we've been talking about too. Asking to be nimble, be able to pivot, and be flexible. That executive order I'm interested in. I think that's a sign of being flexible.
You talked about the two-facility approach to resolve the hospital situation yesterday. Is that still kind of pending as it was yesterday, or was there more progress today?
No more progress yet. The day is still young in our world, so we may have progress on that later today. But as of 3, not yet.
The status being your pitch is still before the state.
Yeah, and these things are one of them is going to get approved, if not both, because this is the answer they asked us to find. So it's just they have a regulatory process where they have to figure out on their end how to do it. We're almost there.
You say one's going to get approved, not both, one facility?
One, if not both.
One.
Yeah, yeah. So I mean, I would think both of them would be approved. That way, you have these approvals in place when you go into. If we continue to make the progress of this virus over the summer, things are going to slow down. Then if it comes back like influenza, late fall, early winter, things will start to pick up again. And so you're going to want to have, I'm assuming the same executive order will be in place throughout this process. So you're going to want to have your plan and your infrastructure in place to address this through the spikes. So,
Is visitation at maybe not nursing homes, but assisted living facilities, any lesser care facilities, is that part of a phase to allow more visitation?
yeah, I think state DOH has to figure that out. If you look at what happened with the cases, really tough what happened. And so that being a slower process for approval makes sense. You just got a lot of these folks healthy. There's the belief you can get COVID twice. So that these are very vulnerable people to this. And eventually you have to work that out because these people need to see their loved ones just like everybody else. And if not, that's going to do different health damage to them. But to date, you can understand you got to get this COVID situation in these facilities under control before you can really open that up. Other questions? Again, I want to thank the community. Yesterday, a big testing day out in Liverpool, town of Clay. I want to thank everybody coming out. There was a lot of folks commented on to Andrew's question earlier about why they were there, and many of them commented about wanting to be able to help their community and do their part in this crisis. And that's getting tested. That's making sure they're not carrying this virus in those cases, and that's getting our numbers up. A lot of people reference that we want to keep our numbers up strong so we can continue to get our economies going again. So certainly want to thank the community for that, and certainly want to thank the community again for the way it's rallied over the last week, 2 weeks. We've really been tested in so many ways, and so I think the fact that we're still hanging strong here is a very good sign for the future of this community. So thank you.